He was born in Silver Creek, New York, which is upstate New York, and he attended Silver Creek Elementary School. There he can only be described as precocious, brilliant, exceptional, and cerebrally gifted. He spent a short time in the first grade and was skipped to the second. Finding that that was not sufficiently challenging, he was moved ahead to the third grade. He made straight A's throughout most of his schooling. He graduated from high school at 16 years of age. His life was not without struggle, however. His mother, who was the light of his life, died when he was 10 years of age. His father passed when he was 14. From that point, he was on his own, basically, while living with his aunt and uncle. Basically, he took care of himself. He was a self-starter in the family. Determined to go to college, he searched every college he could find to find out where he could afford to attend. So as a kid from Silver Creek, he wound up going to the University of Georgia. That's in Athens, Georgia, a far distance from Silver Creek. He rode the bus from New York to Athens, Georgia, arriving with less than $10 in his pocket. Having no Hope Scholarship or Life Gets Better or Bright Futures Scholarship, he worked his way through college, much of it in the dining room. In a classic encounter, he saw a container with white stuff in the dining hall, and he asked, "What's that?" The answer he received was, "Them's grits." Till this point in his life, Nelson still does not eat grits. Upon graduating from the University of Georgia with honors, he headed for Vanderbilt University Medical School. After Vanderbilt, he served as an officer in the United States Army Medical Corps as a doctor. He has a large family, 4 sons who loved him in part because he loved to go fishing, 1 daughter who is quite devoted to him, and 8 grandchildren. And he has a lovely wife of 30 years, Bobby. As I stated earlier, this award is presented to a person who has made contributions in 3 areas. These are service in Rotary, service to the community, and finally, service to his profession. Let's hear from some of the people who have worked most closely with him.
Hi, I'm John Mahoney, a pathologist in the Tallahassee community, and I'm a member of the Tallahassee Rotary Club. Greetings, Nelson and Bobby. I was going to briefly tell the audience about when I first met Nelson in 1981. I just came from academia at the University of Missouri in Columbia. I remember sitting before my microscope and this tall elder statesman walking into my room with a bright white shirt and this peculiar bow tie, which I had not seen in a long time. And he was asking me a lot of questions about a biopsy I have read. I remember sitting there in awe going, gosh, this doctor is really interested in the surgical pathology of his patient specimen that he sent me. And then he sat down before my microscope and asked me to point out the salient histologic details. I really was in awe. I hadn't seen this in 15 years, and this was in 1981. And he knew a lot about the histology. And he started asking me a lot of questions. And I looked at him, I said, this is a great dinosaur of a physician. I hadn't seen it in years. And yet, it really made me a much better surgical pathologist, because over the years, until he finally retired, he'd always come down. He'd always want to see the histology and the surgical pathology of the specimens that he had removed from interesting patients, and I grew to greatly respect his intellect and what he brought to the table on behalf of patient care. When he retired was one of my saddest days because I thought I wouldn't see him anymore. But I think I'll turn to Brian and let Brian tell some stories about his interaction with Nelson.
I'm Dr. Brian Sheedy. I'm president of the Northside Tallahassee Rotary Club and also a physician on the medical staff at Tallahassee Memorial Hospital. I'm a retired hematologist and oncologist and now a palliative care consultant. I first met Nelson in 1974 when we shared an office with Dr. Bud Harrison, Dr. Orson Smith, and Dr. Jack McDonald, and Dr. Galt Ali and myself. And Nelson was part of the office at that time. We found out quickly that we were both from western New York State, east of Lake Erie and the snow belt. And he was from Silver Creek and I was from Clarence, New York. Also found out that Nelson, my Uncle Joe, a general practitioner, took care of one of Nelson's cousins. So we had a bond going back. But I really came to appreciate and respect him as a great chest surgeon. Great experience, always learning, always asking questions, always very correct medically, and also well-mannered. I heard from his friends he was a great poker player at one time, and I always admired those bow ties. Nelson also stayed busy when he retired by participating in our Medical Society Foundation and has stayed active in the medical community and is still well known and really our senior member and dean of our local medical society.
Both Brian and I want to mention what Nelson is currently doing in the medical community. Even though he's been retired for many, many years, Nelson has continued to participate actively with the Capital Medical Society, just as he continues to actively participate with the Rotary Club of Tallahassee. He currently serves on our foundation. He currently serves on the We Care Committee. He is actively involved in raising money for the scholarship program for needy FSU medical students. And lastly, he participates in the access to care needs of the Tallahassee community. I thought when he retired I wouldn't see him anymore, but he is there every month at the Capital Medical Society, and he's there representing the foundation in the medical community. Bobby likewise is an active participant in the Capital Medical Society Alliance with Nelson, and both Brian and I strongly applaud their continued interest in the healthcare needs of the Tallahassee community.
Congratulations, Nelson, on being honored by the Rotary Club of Tallahassee. We love you and respect you and ask you to take care of yourself, Nelson.
Hi there, I'm Dr. Orson Smith, and I'm delighted to be able to speak to my hero, Dr. NelsonKraeft, who I understand is being honored today by the Tallahassee Rotary Club. Nelson is a true pioneer. He came to Tallahassee back in the mid-50s, well before I did. I came in 1962, and I believe he was the first thoracic surgeon in North Florida and one of 4 thoracic surgeons in the state of Florida. Many of you don't know about W.T. Edwards, a tuberculosis hospital that was here in Tallahassee in the 50s. Probably a lot of you in the audience may remember it as Sunland Hospital, which was recently torn down. Nelson did about 630 high-risk thoracotomies and thoracoplasties at W.T. Edwards. And the last 307 cases, there was no mortality. This was with nurse anesthesia, wonderful Anna Marie Connors and Leona Boutwell, no blood gases, no intensive care units, just his skill and good post-operative care. he was a pioneer in a number of ways. He introduced bronchoscopy to the community with his own equipment. He paid for his own equipment. The hospital didn't buy it. He was really amazed when Frank Davis came to town. The hospital provided some equipment for Frank, and Nelson said, "Gosh, I didn't know they did that. I thought I had to buy my own." The next, though, I think, is to really show something about his skill as a pioneer cardiovascular surgeon. The picture that is going to be put up is four good-looking guys: Dr. Fred Butler, who was the first internist in town; the incomparable Bud Harrison, that I think a lot of you in the room will remember; a young, good-looking internist cardiologist from Bainbridge, Georgia, myself; and then, of course, Nelson, looking very young and dapper with his bow tie. The picture was taken by a Turkish exchange student called Alec Hagi, and he had been out at FSU and was sent in from the infirmary in acute heart failure and had rheumatic mitral stenosis, illness we don't even see anymore since rheumatic fever has been conquered. But he had a very narrowed mitral valve, and Nelson did what's called the finger fracture, where you go in with no bypass, put the finger inside the heart, palpate feel the mitral valve, and split it open to allow blood to flow through. This was just one of many procedures that he pioneered in the community. He did 6 mitral commissurations for me with no mortality, and of course later the open heart surgery came along and replaced that type of surgery. Nelson had a lot of courage. He got cigarettes out of Tallahassee Memorial Hospital, and believe you me, that was not easy because a lot of the doctors were smokers at that time. And he got vending machines out of the hospital completely. He integrated the first African-American patient that was admitted to Tallahassee Memorial was a patient of mine and Nelson's that we admitted for a pacemaker. He was a pioneer in the matter of pacemakers. He was peerless in his ability to implant pacemakers with minimal difficulty and complications. And many of the physicians here in town today who implant pacemakers learned from him. He had tremendous ethics. He was the most ethical person I think I've ever known. I don't think he charged nearly enough for his services, and many patients he never charged. He also was a compassionate person. A lot of people felt Nelson was sort of a poker face, but he cared deeply about every patient that he ever took care of. So as you can see, I feel very strongly that when I move on in whatever I'm doing and I look back on those early days in Tallahassee, the one person that comes up in my mind always would be Nelson, and I think it's very appropriate that the Rotary Club honors you today. The Medical Society already has, and I enjoyed participating in that program, and I wish you the very best. And I think you'll probably live about another 10 years, so you better just enjoy it. Have a good time.
Hello, my name's Karen Wendland, and I work as the Executive Director of the Capital Medical Society. So I'm very honored to be here on behalf of Dr. Nelson Kraeft and say just a few words. Speaking for myself, I took this job in 2001, and although I'd worked in healthcare a long time and never met Dr. Kraeft myself, but I knew I was in for meeting a legend even back then. And wow, was I impressed with what a fine gentleman he is and why his fellow physicians said so many kind and wonderful things about him. My main interaction with Dr. Kraeft, though, gave me a keen insight into his sense of humor, because it didn't take me long to realize I wanted him on our CMS Foundation board. So I asked him, Dr. Kraeft, would you be willing to join the Capital Medical Society Foundation board? And he looked at me with that twinkle in his eye that he's so famous for and said, well, given my age, how long is the term? As the Rotary Club of Tallahassee bestows this really prestigious award on Dr. Kraeft, I want to say, on behalf of the Capital Medical Society, your fellow physicians, how proud we are of you, of your community service, the contributions you've made to the medical profession, and all we can say is you deserve it. Congratulations.